I hear a lot of people saying, well, with balanced method, you get quick results, but they don't last. But here, as you can see, by combining these techniques, we could make it last even with just one session, even with a knee that's very degraded, we were able to get a very solid result with a very small amount of treatments. Knee pain is something that we see a lot in acupuncture. So if you have a clinic, if you work with patients, I'm sure you've seen a lot of knees with different kinds of problems, from just pain to meniscus, ligaments. What makes this case different is that this was one of the hardest cases that I've ever seen because the knee was in a terrible state. This was a relatively young patient. It was a 65-year-old patient, but he had his knee completely wrecked. He had knee degeneration, so almost no cartilage on his right knee. Plus, that knee had already been intervened for a meniscus tear almost 20 years prior, where they completely removed the meniscus. So it was a very hard case. The patient had a lot of pain, had severe challenges to moving. He liked exercising, but it was becoming increasingly harder even just to walk, because his knee was in a terrible state. He had already done physiotherapy, he had done injections on his knee, but nothing helped because he was always in pain and always with a lot of problems to move. His doctor recommended knee replacement surgery, but the patient was afraid of the recovery from the surgery and he didn't want to do it, especially because he was still working. He didn't want to stop working, but he also couldn't work because of his knee, so it was a very hard situation. So come with me and let's look into the details of this case, because I think you'll find some very interesting details. If you'd like to learn more about the techniques that I talk about in my videos, check out the courses I have available. I have courses in Portuguese and in English, so check them out in the links below. In these courses I teach the balanced method to treat pain. This is a technique where you get instant relief in most pain cases. So if you want to learn about it, check them out. Again, this was a 65-year-old male patient, and he was suffering from knee degeneration on his right knee. The patient had pain all over his knee, but the biggest problem was on the back of the knee, so on his bladder channel. He had pain right at the joint line and also some pain above and below the knee, so going to the thigh and to the calf. And everything would hurt. So it would hurt for the patient to walk. If he sat down, it would hurt him to get up. He had a lot of pain during the night, so he couldn't sleep because of his pain. So it was becoming very hard for the patient to deal with this problem. There are several strategies to treat knee pain. In fact, I've already done videos on knee pain. If you want to check out here the video card, you can see one of my main videos on tricks to treat the knee. And if you've seen it, you probably already know, whenever I see knee degeneration, cartilage problems, I always start with bloodletting the back. And in the back, what I do is I use an area that was developed by Dean Musher, but that comes from Master Tung's point, dt.07. dt.07. But instead of searching for the point, what I'll do is, on the same side of the pain, I'll search for an acupoint that sits between the line of the spine and the beginning of the scapula of the patient. So all of this area, I'll palpate it and I'll find the place that is more tender. Then I'll do a few pricks and I'll do wet cupping on top of it. And as you can see, we got a lot of blood from the pricks. Sometimes in the back you get almost no blood. There's not a direct connection between amount of blood and clinical results, but in most cases, if the patient bleeds more, you might expect a better result. Once I removed the cup, I asked the patient to walk around the room and to move the knee to see how he felt, and it was immediately a lot better. There was still pain, but it was a lot easier for him to move and there was a lot less pain than in the beginning. So I knew that I hit the right spot and that we were on the right track to improve his knee. But I kept going. So I asked the patient to go to the treatment table and I started using acupuncture. And what I did was, on his right arm, so the same side of the pain, I searched for acupoints around lung 5. Because, if you remember the balance method, the lung balances the bladder, which was the main problem in his knee. And I found 3 very sore spots, one right at lung 5, one slightly proximal, so closer to the biceps, and one slightly distal, so closer to the forearm, which exactly mimicked the patient's pain, which was the center line of the knee, plus a little bit above and a little bit below. So I used 3 needles around lung 5 on these 3 acupoints that I found. But the pain was not just on the bladder line. The patient also had general pain all over the joint. So I went to the opposite side and I searched for acupoints all around his elbow and ended up using acupoints close to heart 3, large intestine 11, and lung 5 on the opposite side too. Along with this, I added an amazing Master Tung point for knee that I've already talked about in the channel, which is Shi Ling, or knee efficacy. This point has the shunjing of the heart, the kidney and the liver. And after these points, I added 2 more points. I added a point in the ear. This is just using the regular ear map that was created by Nogier and perfected by Dr. Barr. So I used the knee on his right ear. And also on the right side, I used YNSA extra knee point. Also on the right side, because both ear acupuncture and YNSA are generally used on the same side of the pain. And this was the treatment for the patient. I left the patient relaxed for about half an hour, and when I removed the needles, I asked the patient to try and walk around the room, and there was 0 pain. The patient said the knee felt stable, there was no limitations in movement, and there was no pain. Unfortunately, this patient lives very far away from my clinic. He lives across from Portugal, more than 400 kilometers away from my clinic, so he can't come every week. I told him that in the beginning of the treatment we should do 4 or 5 treatments, probably at least once a week, but because of logistics it wasn't possible, so the patient could only come back after a month and a half from the first treatment. When he came for the second session, the patient told me that for the first week he had absolutely no pain and that he had no limitations in movement, but then slowly the symptoms started coming back. But that even with almost 6 weeks from his first session, the pain was still not as strong as in the beginning. He could exercise more because he had more movement in the knee, and the pain that he had at night, which kept him from sleeping, had completely gone. And as you can see, even in a case like this where we can't do the frequency that we'd like, in a case like this I'd like to start ideally with twice a week and then go to once a week, and only maybe after 2 months of sessions or something we'd start spreading out the sessions. But even with 6 weeks between the first session and the second one, we still had improvement and we still had quality of life gained by the patient. This is why I think integrating bloodletting and distal acupuncture, Master Tung acupuncture, balance method is so important in a practice, because these techniques are very powerful. I hear a lot of people saying, well, with balance method you get quick results, but they don't last. But here, as you can see, by combining these techniques, we could make it last even with just 1 session, even with a knee that's very degraded, we were able to get a very solid result with a very small amount of treatments. Again, this was the second session. The patient doesn't know when he will be able to come back, but even by just doing a few sessions a year, you can see that the patient is getting real benefits. So if you can, learn these techniques, because I guarantee they will make a difference in your practice. Thank you so much for watching. If you like this video, don't forget to like and subscribe to the channel and share this video with anyone that might benefit from it. And I'll see you in the next one.